Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Good evening. Welcome. My name is Abby Tyler. I'm your host. Welcome to Tuesday's show. Today's topic, as promised, is breast cancer in men. Topic is, are men at risk for breast cancer? We talked about female breast cancer last week, and we always talk about female breast cancer because October is Breast Cancer Awareness Month, and we always talk about breast cancer in women. But did you know that the third week of October is also known as Male Breast Cancer Awareness Month week? So we're gonna get right into the program. As always, my disclaimer: I am a provider, but I'm not your provider, so please do not make any changes to your health regimen before speaking to your own personal provider. Okay, so let's get into it. As you can see, I put the flyer up for this show, and let me just go in here. It wasn't just a clickbait, okay? This is everybody knows who the person is. The girl is that would be my right. Her name is Beyonce. For those of you who don't know her, look her up. Her sister is Solange. They're one of Beyonce is one of the biggest female pop stars, R&B, all that of all times. Best writer, best She's won so many awards. The person next to her is Matthew Knowles. That's her dad. Okay. He was also a manager and all that too of her group. He was diagnosed with breast cancer a couple of years ago. Now let me just go back in there. So the reason I put both of them up is because he said one time he was laying in bed and every time he wakes up, his shirt would be all bloody up and he saw little spots of blood and all. And he was concerned. So I talked to his wife too, and his wife said, "Yeah, I've been noticing that. I've been seeing some bloody stains on the pillowcases when you wake up too, and all that where you sleep." So because he used to work for the Xerox company before, and he saw people doing mammograms there, so he's like, okay. But he talked to his doctor, and he said, "Well, let's do a mammogram and see." I think last week I misspoke and said men don't get on mammograms. So he went there, and they went and did it, and sure enough, he had breast cancer. And they also tested him for the BRCA genes, like I told you guys last week, the BRCA, this BRCA1 and 2. We've all, for most of us, got to know about that when Angelina Jolie, another star who came out and had the same gene. So he got tested for it, and turns out he's positive for it. So the reason why I also put her picture up there too, because both the kids now they have high risk of getting it. So, and for men who have the BRCA gene, they have a higher chance of getting melanoma, which is the skin cancer, pancreatic cancer, and also prostate cancer. They have a higher risk of that. For women with the BRCA gene, you have a higher chance of gynecological cancer, meaning everything below the waist area. You're talking about your uterus, your ovaries, and everything else that come along with that. So that's why it's important. That's why when I was asked to talk about this topic today, I went and did my stuff and also learn more about male breast cancer to bring it to you guys. Okay, so let's start. Alrighty. So because of that, and they both Solange and Beyonce had to get tested. So if a man has breast cancer, it's similar to when women have breast cancer and all that. You have your first degree relative, you have a higher chance of getting it. And then also both her children had to get tested. Of course, they didn't tell us what their results were. That's their private business. They don't have to tell anybody if they don't want to. So it's not just male getting breast cancer and saying, "Oh," but also you have your children and your male. Also, they have to get tested for that. The biggest problem when it comes to breast cancer in men is the stigma that goes along with it. Because we're talking to one of the survivors, he said when get your mammogram, for those of you who have gotten mammograms or any kind of female testing, for specifically mammogram, you go in there and you have the pink robe that you have to put on, or a light color robe, and you're sitting there. If you have other men in the waiting room, they're always there with their wives or like the significant other, and it's like, who wants to talk that to their friends about male breast cancer? Look at you kind of strange, because it's like, okay, first of all, I never heard of it, and what are you doing with your breast for you to be having breast cancer? So there's a stigma in and talking about, and the stigma in going to get help and all. And so that's why some men don't, they wait until it's too late. So it's important to talk about it. Once, as long as you have breast tissue, you're gonna, you're at a risk of breast cancer, but there are those who are a higher risk. So let's get to that, right? So even though it's rare, I'm just going to read the statistic. Even though it's rare, men can develop breast cancer. In the United States, approximately 2,700 men develop breast cancer each year, and it is estimated one out of every 1,000 get the disease. Will get the disease sometime in their lifetime. We should, in comparison, in women is 1 to 4. So 1 to 8. So by you talking about me 2,700 men, it could be your family, it could be your brother, it could be your father, it could be any male relative, male friend. So that's the reason. Okay. The outcome of breast cancer, okay, so okay, what are the chances of them dying from it? Of course, even as in women, the outcome of your breast cancer it depends on whether the stage that it's in, and your overall health and how aggressive the cancer is, and if it has spread. When they tell you metastasize, it metastasized. If it has already spread to other parts of your body, taking care of that could be a little bit, more complicated. All right. So we'll go there. And also, as male and black male are at higher risk of getting breast cancer, because he was talking about it. He did a show on Good Morning America. I'm going to post the link. And he was talking to Robin Roberts, who's also on Good Morning America. And she had breast cancer too, and I think she had another cancer that's really rare. Her brother came down with it. And also Michael Strahan, who was on there too. He's a football player. I think was a football player before. He was one of the hosts. His brother came down with it. So right in that little place, they have 3 people who are positive for it. So you can see how prevalent it is. Not prevalent, but it's there. Okay. So some of the symptoms, going back to also similar to females. This is all for male who are assigned male at birth. Okay, meaning that you didn't change your sex and all that. Okay, so when you start feeling pain in your breast, usually by then it's like already too late. Not too late to, but you pass a certain stage now, from stage 1 to stage 4. And when you get to that point, stage 4, that's when it's like almost to the end point. Okay, so if you start having any pain or tenderness in your breast, bring that attention. All the things you have to bring to your doctor's attention. You should never see any breast coming from you, any blood coming from your nipple. As in women, never, 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 never. If that happens, do not wait. Go directly to your doctor. Okay, a lump in your breast. Men, do not you have lump in the breast. A lump in your lymph nodes, like under your armpit there. If you start feeling around there. Any kind of tenderness in that area. If you see any dimpling in your breast, if you notice that you see any like a little dimpling in your breast, sore nipple or breast, your breast shouldn't be sore, and especially for men, you don't go to monthly hormonal changes and all, and you don't go to many hormonal changes as women, so you shouldn't be having any kind of tenderness in your breast. Nipple discharge, again, bloody, or whether discolor, any kind of color, any drainage for your nipple is not normal. Changing the nipple appearance. Okay, you look at your body every day when you take your bath. You know how your nipple looks like. If you start seeing it looking dimple, you start seeing it changing color, a little ashy or darker, anything there, bring that to attention, and any kind of discoloration. Okay, one there to so. All right. So most of the time, sometimes you're there, you say, "Oh my God, I feel something," and I get scared. It could be just something benign, but you want to get checked to make sure that it's nothing more major than that. Okay. So some of the causes of breast cancer, a few conditions. Most of it is, again, it's because you were male. As you get older, and you need just the mutation in genes and all. But as you get older, that also the condition usually will start in people like elderly. Okay, the common conditions, the condition increases in advancing age, and the most common age of breast cancer diagnosis in this population is about age 70. But as you can see, Beyonce's father was not even in his 70s at the time. And again, Michael Strahan brother's not in his 70s. So you want to get that checked. All right. So some of the causes there, family and genetics. If your mother had the BRCA genes, or a family member, your father had first degree relative, or a brother or sibling had breast cancer, the gene, especially if you have the BRCA gene, it runs in the family. Make sure to get tested for that. BRCA 1 and 2 increases your chance of getting and so it's an estimated roughly 20% of those assigned male or birth will develop breast cancer, and there's no identifiable risk. So, okay. But the BRCA genes is the most important one there. Klinefelter syndrome. Let me see. This is the body type. If you have this, usually this is diagnosed at birth, where you have like the broad shoulders. The male have some breast tissue going on, prominent breast tissues, and they also have other cognitive difficulties, and also smaller size penis and testicles and all. That's a higher chance that you get, because then you have like more just Sorry, that you have the X chromosome, you're born with an extra X chromosome, so that also increases your risk. All right, and history of any kind of cancer treatment. Let's say you had lung cancer, or you had any kind of treatment that it did anything to your chest area, that increases your risk too, because the radiation and chemotherapy, also medication they use to destroy the cancer cells in that area, can increase your chance of getting breast cancer and primary or secondary cancer. So if you had anything that they treated with estrogen, other things, anything else that any other medication they put into your body that they treated cancer elsewhere in your body, can also come up with that. And so let me just go in here. So we're just talking about that. Keep in mind those who are transgender and trans feminine who had estrogen therapy, those who are not assigned female at birth, male at birth, if they using all these different therapies, estrogen and all that, that higher chance of getting that too. All right. And your lifestyle factors. Smoking is also a major cause of that, making sure you exercise. Excessive weight is another risk factor. Gynecomastia, you don't have to be born with that body type like I showed, but some men are born with some breast tissue, a little bit breast, and that goes away in the teenage years, maybe like later on in the childhood. Some people continue with that. So people might say, oh, this person has little man boobs or whatever to call it and all that. Not like with the excessive weight gain, you can see like they have more prominent nipples. Make sure that they check in on that. There's nothing wrong with that. It doesn't say there's higher risk of just one of the risk factors that you may develop breast cancer later on. Okay. Alrighty. So let me go in here. So diagnosis. All right. So most of them there's no screening diagnosis for just saying, okay, if my family has this, if you had the BRCA genes and your mother or father had it, of course you want to get tested, and you're going to speak to your doctor about it and say, okay, should I have to go for a mammogram, or do I wait until I feel something? Or with men, it's a little bit touchy, and research is still ongoing. For as of now, there is no recommended annual screening for men to have mammograms. They can do it if they're high risk, and speak to your doctor, like I said before. Okay, so they can do the mammogram. And I noticed last time I wrote some stuff, and then people were saying, well, we don't, some of the things you're talking about, some people may not know what it is you're talking about. So some of the diagnosis, like I said, breast, you can do the mammogram. The first thing we always do the screening mammogram to make sure that you do that. This is the mammogram machine. Okay, this is it. All right. So the whole machine is right here, and they take this part and this part, and they put your breast on there. That is not me. That's just Google picture. Okay. Then they just put there and you press that your breast down, real touch, and they make sure like just really tight. It stays there and just squeeze out. It's like you put in something real flat on you. And they do that. They tell you hold your breath. They press it down, and that kind of looks over the whole breast tissue and look back. They do it sideways. They do on your armpit and everything to do that. They can also do like a MRI machine where they can take you in there and put you. This here, this is also like a CAT scan machine, but this one CAT scan, you can see on the outside of it. MRI is when you go in there, it's like a little tube. You go in and you have to remain completely still until they do the test. You cannot move. You can move your eyes back and forth. They usually tell you to keep your eyes closed because you feel like you're just in a little coffin. And they do that. So for more definitive testing, after they do the mammogram, they do everything else. And your doctor may recommend that they do additional testing to make sure they have definitive diagnosis before they go ahead and have to do like a needle biopsy, like I said last week, or have to do an incisional biopsy where they cut a little part and take a tissue out and send that to the lab. Okay, they can also do an ultrasound. This is an ultrasound where they put the gel on your breast and they press that in the ultrasound wave, send it to the machine, and it lights up, and all that the places that light up, that's when they look to make sure that nothing is abnormal there. Okay, so those are the different ways that you can get the biopsy, and then if they find out if something, that's a different way you can do the diagnosis, and then after that, that's when they do the biopsy if they have to. Okay. All right. And again, like I said, with men, the stigma, you have to go through all you have to go through to get the mammogram. You see women all sitting there. Ultrasound, at least, it's not just women sitting there and all, you can go in there and come out. But the mammogram place is always like a little suite where everybody's sitting and you have all these different things that only appeal to women and not to men. So most companies are coming around now. But like I said, when I went to get my mammogram as of recently, I didn't see anything that really specifically for females, and but there was nothing there that would make a man feel comfortable being there either. So you can call and say, okay, when can I make my schedule? Let me do my testing in a way where not too many people will be there, because I don't want to have to explain to anybody why I'm sitting there all by myself. And people will start speculating. Okay, did he change his sex? Did he do this? And I know you just happen to be one of those people who have all those risk factors, or you don't have any of those risk factors at all, but you just happen to become, one of the statistics. So alrighty, so let's go there. So again, like I say, if you feel any of those symptoms like I talked about before, I know the stigma against men having breast cancer, anything that has to do with anything is more female and this and whatever, please, just put it behind you, or put it somewhere else and just go get checked. Okay. You don't have to impress anybody. I know we live in a social media world and everything. We have to be on Facebook or wherever and showing everything. You don't have to tell anybody. That can bring me between you and the person, your significant other or your family member or somebody you hold dear. You don't have to tell anybody. You don't have to come on. Even if you don't, you say, I want to come on and teach other people. You don't want to say it. You don't have to say it. That's your own personal business. All the most important thing is going to get the help. All right. So the treatment depends on, like I said, where you are when you get diagnosed. Or they might see something and say, okay, we'll probably have to do, Mr. They can also take out all your breast tissue, the complete surgical repair. They can also, and they'll tell you chemotherapy, radiation. I don't go too much into different treatments and all, because everything is tailored specifically to where you are when you were diagnosed, all your other risk factors and all that. So I don't want to say, oh, they'll do this. And you might say, okay, how come they didn't do this for me? How come they did that to me? I don't know your medical history, and you and the oncologist, your family doctor, the hematologist, the oncologist, and you always sit together, a radiologist would sit together, have a whole plan on what it is that they have to do. Okay. So coping, all right. Learning, most important thing is that learning, if you were diagnosed with it, learning about a disease, dealing with this any kind of pain, but it's important to address your emotional response to it. And sometimes you may have to see a counselor, because again, like I said, for men, that is like really coming at your manhood, basically. For women, we go through that too. But for, it's like, okay, am I supposed to tell people I have breast cancer? How do I tell people? How do I even go to get the help? I'm not doing it. So you have to come to a realization and say, I have to, this is something that I have. This is not something that I brought on myself, even if you brought something on yourself. Okay. Or like you said, okay, if I hadn't done the chemotherapy for this one, if I hadn't done something for lung cancer, if I wasn't doing this, if I wasn't overweight, if I wasn't over whatever it is, okay, you could be all of those things and be completely healthy, and still something could happen. So you want to talk about that. You may be feeling anger, a sense of hopelessness, anxiousness, a combination of all those other emotions. Talk it over. Most of the places that do breast cancer treatments or anything that has to do with biopsy, they always have like a whole support group that you can call on. On Facebook, I went on there and saw all these many different things about breast cancer in men. The ribbon for breast cancer is like a little purplish. It's not just pink, because they say purple because men get breast cancer too. Okay, so the most important, like I say, be aware of your feelings, acknowledge your feelings to your significant other, talk to people who are important to you, who I always say, who are the stakeholders in your life. Don't say everybody doesn't need to know that. People who are important to you will know that. And it's hard to, like, even with, in our area, especially when you come to like cultures that are really close and all. I would say specifically, maybe I'm talking more about African cultures and other cultures too. Even in American culture, it's like, okay, whoa, my God, for a man, even sometimes when on Facebook, I used to say everything you say that's weak is man, is female, when it's, oh, don't be the adjective, or don't, everything is associated with female weakness. So imagine if you had to go somewhere and something that cuts deeply at your manhood, to have to say, this is what I have. Okay. So even talking that to your significant other, to your family member, you'll feel like, what's wrong with me? Why do I have to get something that's a woman disease? But if you have breast tissue, you are at risk for having breast cancer. Okay. So think about the following. So consider support group, look into community. Again, like I said, most of those places have support groups. If you talk to the hospital support groups, you can talk to the oncologist, the hematology oncologist, is the blood doctor and cancer doctor. Talk to them. Talk to people. Maybe there's some group in your church. Sometimes you never know these things until you go start looking. And there's so many. You can Google everything. You can put male breast cancer when support group in, when you can put your county. You can put maybe your city. So it may not be close to where you live, but it can be close enough to where you can drive to, or be, talk to somebody on the phone, talk to somebody. It can be via Zoom or whatever it is, but it allows support group on social media, Facebook too. And so you can just type it in Google and just find and get help. The most important thing I would say to this is, make sure you get help. Talk to your doctor about your risk factors, okay? And make sure that if you feel anything, again, like in last week, I told you guys, I said when the female's doing this, you can do the same thing, for men, because you don't have a bigger breast. So you can just do again with your fingers, go around, go around, go around, and all that. Do this. You get to your nipple, you squeeze it. There's nothing, should be nothing there. Reach on your armpit, press all that too with your fingers. Go all the way back there, all the way back there. Okay, those are all breast tissue. That your lymph nodes and everything's in there. If you don't have to wear, again, for me, and like I said, I don't wear roll-on for 24/7. If I'm going to bed, I don't put on roll-on because it has the deodorant, it has antiperspirant that stops you from sweating so you don't smell, because that is blocking everything else. So I'm not saying you shouldn't, you should. That's just something I do for myself. Most important thing, also eat healthy, exercise, don't smoke, stay away from alcohol. If you do that, please do that in very low moderation. I know some people who say they drink, I just drink alcohol in low moderation, and then they drink from Friday to Sunday until it's time to go back to work. Okay, so do that, exercise, and stay healthy. All right. So I was, all the requests that I got to talk about this, I'm really happy that I really went into it. And there's more information out there. This is not comprehensive. So you can still talk to, when you see your doctor next time, be like, you know what? Somebody said something about breast cancer, and it says something in male breast cancer. And there's actually a male breast cancer awareness week in October, and I know somebody said, oh, us women can't have anything. And it's like, it's something where that we can save the life of your brother or your sister. Your sister will be breast cancer, and also your father, and all that. So remember, also, if your father has this or your husband has this, your children have to be tested too, because now they have a risk of carrying that gene. Okay. So let me just see here. Augustine Musa said, good morning. And let me see what he said. Can the breast cancer be transferred to men? Not from, it's not something you get infected with, but if you, let's say if your wife have it, no, you don't have the same genetic makeup and all that too. So that's something you would get simply because if it's like just your biology and just your genes and all that. Okay, let me see here. And then, okay. So let me close this up. Okay, so I know of a male female breast cancer, there's so much more and all that. So for breast cancer, male breast cancer is basically, again, going back to it, getting checked, do your breast check. I guess it doesn't matter whether you do it every month because you don't go through the hormonal changes like women do. And if you feel anything, if you see any kind of discharge coming from your nipple, especially blood, it should never be blood coming from, and female also, there should never be blood coming from your nipples. So if there's anything there, just make sure you go and get the help that you need. Okay, talk to your family doctor, and right away they're going to send you to get a mammogram, and then you go on from there and have a male breast. They do have male breast specialists too. So, but they also have like the cancer doctor and all, so they can go through that. And I wish you all the best of luck. Okay, and just staying there, hanging there, speak to people who really support you. It's all about you. You'll be amazed how the support from other people will really help. And all, again, just tell people who need to know all these things. Don't go telling your business to everybody. If you don't want to, you don't have to. But if you have family members, direct family members, your brother or your children, or see, even your sisters too, make sure you tell them. Maybe especially if you have children, make sure they get tested. Okay, so that's the reason why I put up Beyonce and the father, because I'm sure they got tested, but that's their business. So that's all I have to say today. Okay, if you like this video and it's helped you or helped somebody, please share. Please share. Please share it. Give me a thumbs up. And if you have not followed my page yet, please like and follow so you can get more great videos over from now on. It's okay. So, but thank you all for watching, and I will be back on Friday. But thank you all for watching, and you stay safe out there. For those of you who are watching now, I say thank you. For those of you who will be watching later, I say thank you as well. If you have any additional comments or questions, please just leave them below and I will respond to them. Okay. So for those of you who are watching on Focus on Liberia, Abby Tyler's Healthy Living on YouTube, I say good night. Thank you. And I'll be sharing a video on other forums later. Thank you also very much for watching, and good night.